The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome everyone to the webinar titled The Healthcare Law and You, How Does the ACA Help Asian Americans, Native Hawaiians, and Pacific Islanders in Region 8? I'm Franco Chamakili, a Policy Associate for the Asian Pacific Islander American Health Forum. And we have a really dynamic panel today that will talk about the ACA and some of its impacts in the AANHPI community. First, we'll hear from Marguerita Salazar, the Regional Director for the U.S. Department of Health and Human Services for Region 8. And then following Ms. Salazar, we're going to have Sefa Aina, a commissioner from the White House Initiative on Asian Americans and Pacific Islanders. And then after Sefa, we will have Fahina Pasi, the Executive Director for the National Tongan American Society. But before we start, I wanted to just go over a couple housekeeping issues. First, so you know, today's presentation is being recorded and it is closed to the press. And we will be sharing this webinar with all the webinar registrants. And if you notice on the right-hand side of your screen, you'll see a webinar toolbox, and you can ask questions during any time of the webinar to any of our panelists, and we will have a question and answer portion of the webinar at the end. But without further ado, I'm just going to go ahead and turn it over to Marguerita Salazar, Regional Director for Region 8.
Thank you so much, Franco, and welcome to everybody who's been able to call in. I really appreciate your taking the time to do this because I think it's this kind of information and these kind of webinars that are going to help people as they try to navigate through the healthcare law. And I think that what's most important is that you get your questions answered and that I try to provide as much direct information as possible to you. We have been able to synthesize what is about a 2,000-page law down to just a few slides, so I think you'll be surprised that it's not really as complicated as some people would make it be. So let's get started right away. First of all, I think that with the next slide, thank you. The problem that we all knew about was very, I think it's multifaceted. It wasn't just the fact, though, that insurance companies had been practicing some very discriminatory practices where they were throwing people off their health plan. They were making premiums be so expensive that people across the country were not able to buy insurance and be able to access the care that they needed. And so over time, my background has been that I've worked in community health centers, and we saw the numbers of uninsured begin to grow and grow and grow, and instead of getting smaller, they went from a 37 million number when I first started to 50 million when I left 2 years ago. And so we saw that the problem was really a huge one. It was something that had been on everybody's platform for years and years, but there really had not been the will to take on what feels like such a huge issue. And it is, because it impacts everyone. Next slide. And so we were very lucky, and I always put this in here because there are some people in the country who still do not understand that this is actually a law. It was passed and signed into law in March of 2010. And so we've spent the last 2 years implementing the different pieces because it comes in phases. Some things are already enacted, and we'll talk about those, and then other things won't come into play until 2014 and beyond. Next slide. There are 5 main things that I would hope that you could leave this seminar knowing. And first of all, that this law protects all Americans from some of the worst insurance company abuses. When people would go around the country talking to constituents about what is it that we need to change in healthcare, it wasn't so much their providers or even the hospitals, but it was really about how we pay for this. Because there were people, if you can't get to a doctor, if you can't receive the service, it doesn't matter how great a healthcare system we've got in our country. So that's why the second piece is so important, that this law will make healthcare more affordable. When I talk to seniors, I always start with your Medicare is safe. And this law does strengthen Medicare. Not only preserves it, And I want to start from the beginning saying not one benefit is going to be cut from Medicare, but Medicare, in fact, will be strengthened. We're going to increase access to care because we know that there are a lot of places in rural America, frontier America, in our region, where there are just frankly not enough providers. And so this law is working to improve that and also to reduce health disparities, which goes along with the minority populations that we care so much about. Next slide. We talked for a long time about a patient's Bill of Rights, and we have one today. First of all, children up to the age of 19 can no longer be denied coverage by an insurance plan because of a pre-existing condition. This is a really big one for families who have children with a very serious illness or who are born with a congenital disease or something else that could happen as a child. It puts a lifetime cap on how much care or takes away the lifetime cap. So it's gone. All of those things that used to be right there within your insurance plan are no longer there. The lifetime cap was one of those things that was causing so many Americans to have to file for personal bankruptcy. A healthcare issue was the #1 reason why people would file for bankruptcy, so there is no longer a lifetime cap. Annual caps will also go away by 2014. No longer can insurance companies cancel your coverage when you get sick. Now that sounds really strange maybe to some people, but that's actually what would happen. And we have insurance companies who would actually go through and people's applications, look for reasons to throw them off the plan if they had forgotten to add something onto their application. No longer are any of those practices allowable. Next slide. This is a provision that I think is very, very popular because it impacts so many kids. And I guess I still refer to people up to the age of 26 as kids, because what we're doing is we're allowing this whole group to be able, if their parents have insurance and they don't, to get back onto their parents' insurance. Now this child can not be living at home. He or she can be married. He or she can live in another state and still go back onto their parents' plan. This has been a really remarkable component of the healthcare law. And the next slide shows that here in our region alone, we have been able to add 108,000 young adults from all of our states back onto their parents' insurance. I always kind of kid about, this is a group of people who are typically not very sick, but they do tend to have such active lives that they're the ones who end up in the emergency rooms. They're the ones who fall off their bicycles, they're mountain climbing, they're doing all these things that actually can make them end up in a hospital emergency room. And you know that the minute you walk in, it's at least a $1,000 charge. And so having some kind of insurance for this population is very, very critical. And again, we're real excited that our kids up to age 26 are being able to get back on their family's plan. Next slide. The law increases access to affordable health care in the fact that even though we've talked about that kids no longer can be discriminated because of a pre-existing condition, there are still many adults who are not able to access health care or buy into an insurance plan because of that pre-existing health condition. And the older you get, usually there's something there. And so what we've been able to do is set up this pre-existing insurance plan, PCIP. You can find all about it at pcip.gov. If you know somebody or if you yourself have not been able to find an insurance plan that will take you because of a pre-existing condition, this really is the plan for you. We've been able to get, again, thousands of people onto a plan. This is sort of a stopgap measure that we're using between today and 2014, because in 2014 the law will no longer allow insurance companies to deny people care. But that's not here yet. And so I really encourage people to look into this. It's a way to take care of some of those issues that people may be struggling with today. It's a lot of times I talk to people and they're waiting. They may have a gallbladder issue and they're waiting for it to get worse so that they can go to the ER because they know that at the emergency room they won't be turned away. And so I just feel like that's really a sad state of affairs in a country that does have a good system, but we need to help people be able to access that. And so this is the way to do it. PCIP.gov, the premiums are very affordable, and you can go on there. It's based on your age and not your condition. Next slide. One of the things we've always known is that prevention is worth a pound of cure, and yet we've not done really well in regards to including preventive services in our insurance plans. Well, now they're all in there. Before, all of these things that you see listed on the list, and actually there's a much larger list. If you go to healthcare.gov /prevention, you'll get the full list. But what we used to see before the law was that all of these things had either a very large copayment or they frankly just weren't covered. Even maternal care was something that for many insurance companies you had to buy a separate rider in order to have that as part of your insurance. Today that no longer is true. We want you to sit down with your doctor, your nurse practitioner, your PA, and go through what it is you need for the year. You know, there's another new service called a wellness exam that will sit down with you and say, you know, you're this age, you should have a mammogram, we need to make sure you've had a colonoscopy. Everybody, when they turn 50, should have a screening colonoscopy, but that doesn't always happen because depending again on your insurance, you may have a copayment of up to $500. Today, you have zero copayment, zero out of pocket for those kind of screening tests. Again, these are things that your doctor will go through with you and help you understand what you need to have done. But these are, like I said, this is just a very small list, but we know that we're saving millions of dollars by doing this. Before the Supreme Court made their decision about whether the healthcare law was constitutional or not, many of the larger insurance companies were already saying that regardless of the outcome, they were going to continue providing these preventive services because they had already seen a decrease in their costs by being able to capture some of these issues a lot earlier. They're less expensive to treat, and your chances of survival, of course, are much better if we catch it early. So please take advantage of this. This is available for all Medicare patients and people with insurance. Next slide. Speaking of prevention, we do have a very strong emphasis on prevention because I really believe that this is where it's at. This is where we're going to truly save the millions of dollars by being able to take care of issues before they become really more expensive and actually less likely to be cured. And so today, because of modern science, I think we've been able to take care of those, some of the illnesses that have plagued us for generations. And truly today we suffer primarily from a lot of lifestyle issues, of course in accordance or in conjunction with what you're born with and your genetic background. But things such as heart disease, cancer, stroke, and diabetes, that are still some of the major reasons for death can be controlled if we just stop and work with our provider to make sure that we are doing at least one patient self-management goal, but also allowing the doctors to help us with the right kind of medication. We know that diabetes can be controlled, by losing weight and exercising. We know that when you stop smoking, your chance of recovery from heart disease is a lot better. And so we're really putting a strong emphasis on prevention. We want to root out the causes of chronic disease and focus on fighting those illnesses because truly we want to be in control of our own life. Let's not let our disease control us. Let's control it. And so we've got a lot of ideas, and there's a lot of different organizations that are working on doing this prevention, and Public Health Fund is now available where you can find more out about that because every state has received federal dollars to work on these issues. You can go onto the website, which is www.healthcare.gov. There's a map of the country, and you just click onto your state. And if you look under prevention, you will be able to find out what kind of funding your state has received and what kind of programs that they're implementing to address a lot of these issues, because we know that every state is a little different. Every state has different priorities, and so the federal government, as part of the Affordable Care Act, is very strongly focusing on prevention activities. So please check that out. I think that this is probably one of the most important pieces of the whole Affordable Care Act. But let's go on to the next slide now. So as we go back and again look at insurance companies, one of the things that used to happen was that people would pay their premium, the insurance company gets it, and then they promptly would invest it into a lot of different areas. Unfortunately, it wasn't always healthcare. And so when providers would then bill their insurance company, they would usually get denied a payment because maybe a certain box wasn't clicked off, or maybe, you know, there was a lot of reasons why insurance companies would deny the payment. And I speak firsthand from that because I did spend 25 years in primary care and learned a lot about how to truly be able to bill and collect all the dollars that were out there that people had paid in their insurances. So what we found was that insurance companies were sometimes only paying as much as 40 cents of every premium dollar toward health care. Instead, they were investing in real estate, they were marketing, they were doing all these things. You know, we've heard a lot about and seen CEO salaries and all of the bonuses that CEOs were getting. Well, today, no longer can that happen. Insurance companies are required to spend at least 80 cents of every dollar on health care. And, you know, that seems like a really reasonable thing, but that wasn't what was happening. And the secretary started gathering information on this, and she found out that, on the next slide, that insurance companies are going to be required to give back. And in fact, they're already giving back over $1 billion. We know, again, that in our Region 8, our states will receive an estimated $35 million in rebates. I'm seeing this all sorts of ways, you know, from individual people who have told me that they've received checks, some like $20, $48, to cities, like there's a city here in Colorado, Pueblo, Colorado, received $444,000 back in rebates. And so this is all coming back. It's already implemented. And again, because of this, we're starting to see that premiums are starting to drop as well. Next slide. So this is the way you're going to see some of that. You know, you may get a rebate check. Your employer or may receive a lump sum reimbursement. You know, and you'll be able to they'll apply that rebate to your next premium bill. You know, you might get a debit card. There's all sorts of ways, and I suspect if we opened it up and asked you, some of you have probably seen some of these changes. But again, the idea is to really pay for what we're getting, and to not allow these insurance companies to be making so much money while people are suffering and losing their homes and declaring bankruptcy because they thought they had insurance that was going to pay for their health care. Next slide. The other thing that we saw a lot of when the law was first passed was a lot of complaints about the fact their premiums were continuing to go up. Now, initially there wasn't a lot of oversight on that, but part of the law is that insurance companies are not allowed to raise premiums by double digits unless they have really sound actuarial reasons for doing so. And so your individual states, through your insurance commissioners, are monitoring this, and also the Secretary is also monitoring that. We have seen a lot of insurance companies have to give rebates again because they increase premiums by more than 10%, and the states do have powers to block them. Some states already had some of that rate control, but for those that didn't, the federal government has stepped in and helped control those really huge premium hikes. And so again, after 2 years, we're starting to see that the average has really gone down. I think we all saw some news earlier this week that premiums have increased at the slowest rate ever since the last 10 years or something like that. It was all over the news. But you know, while they're still high, the rate of increase has really dramatically slowed. And I really believe that it's because of all of these monitoring tactics that the federal government is using on insurance companies. Next slide. This is important, or just so important, you know, again, because I feel that Medicare recipients are often those that get scared a lot. And I think that people try to scare them on purpose. But first of all, let's go back. We know that Medicare recipients receive all the preventive services and the free annual visit. They're now getting a 50% discount on covered brand name prescriptions when they hit the donut hole, the donut hole, coverage gap. And so they, and again, initially when in 2010, when the bill was first passed and signed into law, seniors were getting checks of $250. After that, it went to this 50% discount. There's also a discount for generic drugs that is right around 14%. So there really is this great assistance for seniors when they're trying to buy prescription drugs. We know that that's another thing that seniors will do without when they don't have the money to buy their prescriptions. The donut hole will be completely closed by 2020. Another big piece for Medicare is the cracking down on fraud, waste, and abuse. And we know that a lot of that has been going on for years and years and years because there are fraudsters, crooks, who are out there who have stolen Medicare numbers, and then they can somehow set up a business that can help them pretend to be a provider, and then they bill Medicare for millions and millions of dollars. So Secretary Sebelius, Attorney General Holder have done an awful lot of work on cracking down on those fraudsters. They have been able to recoup over $11 billion. That's with a B. This is more money than any administration has ever been able to recoup in the past. But they're really cracking down. They're looking to see who's doing it, where they're doing it. They're not only looking at states like Florida and California and New York, but there are actually a lot of groups in our region who have been committing fraud. And so this money is being recouped, and it's going right back into the Medicare Trust Fund so that it can be secure for many, many more years. Today, it's at least secure until 2024, and the Secretary is continuing to work on that to replenish the trust fund so that we can make sure that these people who are stealing from Medicare can be caught and prosecuted. Next slide. The law increases access because, when I hear, especially people in Wyoming, some of the North Dakota, South Dakota, where they're really concerned about whether it doesn't really matter that they have a card or insurance coverage, where are they going to go if there aren't enough clinics or doctors in their communities? And so through Health Resource and Service Administration, there are thousands of new doctors, nurses, pharmacists, dentists, social workers, a whole compendium of healthcare providers who will be placed in your communities to serve underserved folks. We already have, when I left the community health center environment, we had about 4,000 National Health Service Corps providers out there. Today, we've got over 10,000, and it's continuing to grow. This money that is coming from HRSA is also available to build new clinics and new facilities, new equipment, staff, faculty at medical schools, and let's look at the next slide so we can actually see how that's going to work. So here, I hope that a lot of you know about your community health centers in your neighborhoods, because this is really one of the strong safety net services that the federal government is supporting to make sure that people who don't have anywhere else to go will always have a medical home. So the Affordable Care Act is providing the $11 billion over the next 5 years. $9.5 is designated for buildings. An additional $1.5 will support construction and renovation, because we know that a lot of these centers, they've been around for about 40 years, and so some of them are starting to fall apart. So we need to get them, in really good shape and make sure that they're here for the long run. And then again, we're going to nearly double the number of patients that are actually receiving care there. A lot of people say, well, what is the role of the community health center once everybody has insurance? Because, as most of you know, community health centers were initially set up to take care of the uninsured. Well, two answers. One is that there will always be probably a small portion of our population who don't have insurance. But the other one that's probably even bigger is that community health centers are providers, first and foremost. And so since we need additional and our same providers to stay on board, that's the role the community health centers will provide. And so, we're going to continue to support them, to monitor them, and make sure that they're there when you need them in the right places. Next slide. This again, you know, what we're heading into, I want to talk about is will be the marketplace and the exchange, because so many times you'll hear that this Affordable Care Act law is all about crushing small business. And in fact, it was set up to assist small business, because small business has had the hardest time in being able to purchase insurance. Typically, they would pay an average of 18% more for the very same health insurance plan that a large corporation would buy for their employees. And so today, starting in 2010, small businesses can get tax credits to help pay for part of that coverage for their employees. They get up to 35% of the premium today, and they will be able to get 50% in 2014. Now, this is something we've been working with tax preparers and accountants to help small business understand how to do it, because of course it has to be done through the IRS. But again, this is something that we've seen small employers really appreciate when they get that rebate back. It's not only for private business. I want to emphasize that also nonprofits are eligible for a tax subsidy. Now, they don't pay income tax, but they get a subsidy or a rebate on the premium up to 25% today. So even if you're a nonprofit or you know a nonprofit, have them talk to their tax preparer to make sure that they're taking advantage of that. Next slide. So what we're seeing now is that a lot of discussion, a lot of building up for the exchanges, which we also are referring to as the marketplace. Because in 2014, every American will be able to access the exchange if they want that. Now, this is it's a way that people will be able to go into, whether it be a website or talk with an insurance broker or navigators. There's going to be a lot of ways to get to it, but they'll be able to purchase insurance at a rate that is much more affordable than they've had even today. By 2014, this marketplace will be set up so that there are much larger insurance risk pools, so that you're not having to pay a premium just based on a very small group. You'll be able to get tax credits. You'll be able, even people with incomes up to $90,000, which is a federal poverty level of 400% of poverty, will receive a tax credit. Medicaid will also be available to all Americans living with incomes below $30,000. And this is the Medicaid expansion that you're probably hearing a lot about. It takes people up to 133% of poverty if the states do that expansion. And for the first time ever, which I think is really exciting, you don't have to fit into a special category. Single childless adults will be eligible simply based upon their income. Next. So what the health insurance exchange is set up for individuals or small businesses. So the exchange will be a place, you know, we often compare it to a website much like where you go to buy an airline ticket. And you'll go in, you can look at, you know, you add all your demographics, you put in your income, that gets checked with IRS or SSA, Social Security, so you don't have to be providing check stubs and things like that. Then once that information is in, it'll show you, you may qualify for Medicaid, you may qualify for CHIP, or a basic health plan, or a qualified health plan. It'll really help you go through and see where you fit and what's the best deal for you. On this website is also where you'll get your tax credit or your subsidy if you qualify for that. But it's a massive undertaking in regards to just to think about a computer system that's going to be able to be accessible to people all over the country. Plus, they'll be tied into the IRS and the SSA. So that's why I believe it's taking till 2014 to really get it set up. But this is really, I think this is the heart of so much of what we're talking about in terms of health exchange. And this is where Congress will also buy their insurance. We hear so much people saying, I want the same insurance that Congress has. Well, ladies and gentlemen, this is where Congress will also be buying their insurance. Next slide. So what I've talked about to this point is things that you know, a lot that we've already implemented, The exchanges are going to be up and running by 2014, and in 2 years, I think this is really the major change that will happen, because in 2 years, no longer will anyone be able to be discriminated against because they have a pre-existing condition. Insurance companies won't be able to charge women more simply because they're women. We'll have these state-based marketplaces. You know, like I said, members of Congress will also buy their insurance there, and the tax credits hopefully will be, well, they will be up to 50% by 2014, and who knows, even beyond then. We want to make sure that everybody has opportunity to buy insurance, and that it's affordable, because it's not that people don't want insurance, they frankly just can't afford it. So, next slide. I just want you to know and to understand that the law does not add to the deficit. In fact, you know, we spend so much money. We spend 17% of our income today on health care. We've got to stop that, because it's way too much money, and we're not even that much healthier. So if we don't do this reform, the deficit will increase. The CBO estimates that the legislation would reduce the deficit by $124 billion over the next 10 years. And I think that's something we need to remember, that this is going to take time. You know, it's taken a while to get it all implemented, and it's going to take time before we see those long-lasting results. But I'm just so happy to tell you that every day I get news clips, I read reports, I see people, I talk to them when they tell me that their insurance only went up by 3% or 4% when they were used to getting a 20 or 25% increase. So we're starting to see some major changes happening, and I really am looking forward to the next, 5 to 10 years when we're going to see some major changes. The last slide is a picture of our website. This is healthcare.gov. I want to highly encourage you to go there. Right now, we only have it in one other language, which is Spanish. Cuidado de Salud is been up and running. We're looking to do it in additional languages. But for now, it's a very user-friendly website. It's continually updated with all the information. Any kind of information you want to know about a specific disease or a specific state or any of the things I've talked about, you can find it on this website. So please feel free to use it. You can ask questions. You can even sort of play around with the idea of how would I purchase insurance when the marketplace is up. Today, you can go there. You can put in all of your demographics. The website will show you what's available in terms of insurance in your community. The only thing it can't do is give you the subsidy or the tax credit, but it'll give you all the information you would need today about what's available to you and the cost. So I'm going to stop at this point because we have two other people who are going to come on. This is my contact information. If you have any questions, if you want to talk to me, if you want me to go to your state or to your organization and present any of this information, I'm more than happy to do that. Again, it's Marguerite Salazar at hhs.gov, and I really appreciate your signing on. Thank you.
Great. Thank you so much, Marguerite. I really appreciate that comprehensive overview of the ACA. That was really, really well done. I learned a lot. And so now I'm going to turn it over to Sefa Aina from the White House Initiative on Asian American and Pacific Islanders. And he's going to talk to us about the initiative. And just so everybody knows, this is the only slide part of his deck. So just so you know that it will not be changing. This is the slide. So I'll turn it over to Sefa.
Thank you, Franco. And also I want to follow up Franco's sentiments. Thank you, Marguerite, for that exhaustive summary of the Affordable Care Act. I appreciate that. It was very, very informative. I also want to thank a good friend and an amazing leader of the Pacific Islander community, Fahina, for being part of this panel and joining in today. And especially all the folks who are online listening in. So I appreciate your time to really listen to such an important thing in our country right now, and very, very relevant to all of our communities. It's definitely an honor to be on this webinar with experts from HHS and our community, just to hear about some of the great work being done. I just want to take a few minutes to share about the White House Initiative on Asian Americans and Pacific Islanders. The initiative which is some of you will know is started by President Clinton and is currently chaired by two cabinet level secretaries, Chris Liu, who is the cabinet secretary, and Arnie Duncan, of course, is the Secretary of Education. Prior to Chris Liu joining us, we also had we're recently chaired by Secretary Locke, who is currently the ambassador to China. So we've had amazing support from the administration, from very high-level cabinet secretaries. The leader, of course, of the initiative is Kiran Ahuja. She's the executive director and brings 20 years of experience working with the API communities, and as the founder of community organizations such as the NAPOF, the National Asian Pacific American Women's Forum, and Kiran just brings with her sort of the mindset of working with communities, working at the grassroots level, and that spirit and that energy kind of permeates throughout her staff, and then also throughout the rest of the initiative, which includes the commissioners. The White House initiative staff works with the commissioners, for which I'm one of 20. I'm also the vice chair. Our chair is Daphne Kwok, who some of you may know. We're made up of 20 API leaders who sort of represent sort of the diversity that exists within the API community in various ways. Leaders in business, community development, health and education, civil rights, and philanthropy. Also diverse in terms of ethnic and cultural background, as well as regional representation, including representatives from Hawaii and the Northern Marianas and in the Pacific Islander territories. Also, with regards to the commissioners, what you have is a group of 20 practitioners, people who they themselves have many years of working at the grassroots level, working in business and working in philanthropy to really help the API community reach its full potential. The initiative has 4 areas of focus: healthy communities, economic and community development, civil and immigrant rights, and educational opportunities. Particularly our healthy communities, we work really closely with the Asian Pacific Islander American Health Forum, so we really appreciate them again for setting up this webinar. Our goal is to ensure that the federal government works better for AAPIs, and we serve as a liaison between the community and these federal agencies. Since the initiative was reauthorized by President Obama, we've held over 200 events in 25 states, including as well as Washington, D.C. and the Pacific Islands, reaching more than 27,000 community members. We've also held a number of webinars and calls to increase knowledge about federal efforts that impact APIs, and we've channeled concerns about policies affecting API communities to these federal agencies. The initiative is working with 23 different federal agencies, and with asking each of them to come up with focused plans on how to better serve the API community. And for example, the HHS plan, the Health and Human Services plan for AAPIs, focuses on health disparities and addressing health issues prevalent in the API community, such as hepatitis, cancer, and diabetes. The plan includes several objectives to address health conditions and access to health care for services for Native Hawaiians and Pacific Islanders. The HHS plan also supports data disaggregation, which is a general issue within the community that cuts across all the issue areas that we work on. But HHS has really taken the lead in terms of how much they've done with the data disaggregation. It definitely allows all the departments to collect specific data about specific groups in the API population. One of our commissioners, a good friend, Dr. Tung Nguyen, calls the ACA, the Affordable Care Act, a significant game changer for the API health. Up to 2 million uninsured APIs will benefit from the ACA by getting better access to affordable care. The initiative has worked to increase awareness of the benefits and provisions of the ACA through a number of blog posts, webinars, and events. We held a regional summit in Atlanta for the Southeast region that included over 500 participants and was co-hosted by Commissioner Hines Ward. We recently held another regional summit in Ohio. We've also reached out to emerging communities and held events in Oakland for the Mongolian, Burmese, and Bhutanese community leaders. And the initiative has also been involved in events for Pacific Islanders, including an event that I was fortunate enough to take the lead on, the Native Hawaiian and Pacific Islander Youth Health and Fitness Day, which was which held at UCLA. I co-hosted that with Commissioner Hines Ward, and together we brought over 1,500 Native Hawaiian and Pacific Islanders from all across Southern California and places like Utah as well as Northern California. And that particular day we were able to do health screenings for a lot of youth who were for the first time getting some of these preventative health screenings, which we heard from Marguerita is very, very important. We had fitness stations as well for the Pacific Islander community. It's one of our main issues. Our health issues is obesity, and so we're trying really hard to address that. We've gotten support from the First Lady's office through her Let's Move campaign, through letters and definitely well wishes to have the successful program. The initiative also collaborated with Native Hawaiian and Pacific Islander community partners in Salt Lake City, Utah, and the HHS Resources and Services Administration, or HRSA, on innovative strategies to expand healthcare services to medically underserved NHPI communities. We were really trying to get these community organizations, these community leaders, including Fahina's organization, to start to move forward with plans to create a federally qualified health clinic for Pacific Islanders in the region. We were really fortunate to partner with HHS and the region to make that a successful event, and Fahina can maybe talk a little bit more about that. We just want to ensure that the API community's voice is heard as planning and implementation of the Affordable Care Act occurs. And if you're interested in staying up to date on our efforts and getting involved, I encourage you to sign up for our mailing address by visiting www.whitehouse.gov/AAPI. And again, I just want to thank Franco, the Health Forum, and all the participants for making this webinar happen. Thank you.
Thank you, Sefa, for that, and thank you to the White House Initiative for everything you guys do. You guys do some great work for us, and really appreciate it. So now I'm going to turn it over to Fahina, who will talk about some of the great work she's doing.
Okay, thank you, Franco, and thank you, Marguerite and Sefa. Such great information. And then I want to thank both of you for just leaving me 10 minutes, so that's wonderful. Just to give you a real quick background, I'm with the National Tongan American Society here in Salt Lake City, and just so that you know where I'm coming from, it is a very small nonprofit organization, and of course again it's in Utah, very conservative. And so the things that I'll be sharing, go on to the next one, the next slide. Things that I'll be sharing will basically come from a small nonprofit organization perspective. And just to give you an overview of our organization, we are under a board of directors, 11 members, and myself, the executive director. We also have a chief's council. One of their goals is to make sure that we implement things that are culturally competent within our community, Pacific Islander community or Tongan community here in Utah. And then underneath us, or people, we have 4 staff members. We also have 4 teachers or people that we contract with that run some of our educational programs and the likes. We also have our advisory education advisory committee, health and cultural. Next slide, please. Just a brief background on Pacific Islanders here in Utah. We are, since the census of 2010, we have 25,000 people here in Pacific Islanders here in Utah. And from the Utah Health Department, we are the highest, we have the highest rate of obesity here in Utah, also the highest rate of infant mortality. And we also have a very high rate of diabetes. So those are just kind of like a real brief overview of what our health situations are and our population. We are 1% of Utah, just like the United States. We are 1% Pacific Islanders of the United States. And the same thing on a global, we are 1% of the global population. All right, next please. The Affordable Care Act, when this came into play, some of the things that we were able to, we the Pacific Islanders here, the National Tongan American Society, some of the things that we identified that Marguerite already identified earlier, we caught on to and felt that this was something that we needed as a nonprofit organization working to better the health of Pacific Islanders here in Utah. We felt that it was our responsibility to bring the awareness of some of the benefits that the Affordable Care Act was going to bring to our community. And of course, some of those things that Marguerita already covered, so I won't cover that, so those are there. Next slide, please. Next slide, okay. One of the things that I wanted to share, I guess most of all, well, not most of all, but today is that I think it was very important that as a small nonprofit organization, we cannot do it on our own. We needed to network because on our own, we can't really accomplish a whole lot. So I listed a couple things here. We work with the Pacific Islander Student Association at the University of Utah because they also can reach a younger population. So therefore, sometimes they have also they have the computer capabilities and abilities where they can assist us to get these things out to the younger population. We also work with what's called here in Utah as the Utah Health Policy Project, and the Utah Policy Project is basically really important to us because they are, well, along with other things like, for an example, the Asian Pacific Islander Health Forum. On a national level, the Utah Health Policy Project is kind of like our health forum on a state level. They are like our eyes and our ears to what is going on, and they inform us of what's happening on the Capitol Hill, when we need to go in, if we need to go in to bring testimony, bring people in to speak up in behalf of Affordable Care Act, especially those who have had life experiences where Affordable Care Act has assisted them. The networking for us has been tremendous. For an example, another thing that I don't have here, well, I do, I guess, our Utah Department of Health, especially our Department for Diabetes Prevention and Control Program. We have assistance. We don't have, as a small organization, the capability to do research, nor do we have the know-how to do a lot of different things. And so we tap into these resources, such as the Health Forum, such as the Utah Department. And many of these people, because our vision and our goals are basically the same, to create a healthier population amongst Pacific Islanders, they are very willing to assist us. And so in that, we are able to accomplish many of the things that we're able to do, whereas without them, we would have never been able to do a lot of things. For example, things that deal with epidemiology, computer technique, funding is very important. As we get funding not only from the Health Forum, where we worked with a grant that dealt with obesity and diabetes. We also, from the state, we have grants that assist us with diabetes and abstinence, a lot of different health issues. Also, there are many lessons learned as we network amongst Pacific Islander community. There are many lessons that we learn that help us further our program by learning from others. Also, there's in working with another organization, actually it's another department in the Utah Health Department, we were able to, the Utah Health Department was able to release a specifically focused piece of data or survey where they surveyed over 600 Pacific Islanders that spoke specifically about Pacific Islander health here in Utah. And then again, just recently, that was just last year, November 2011, and this year, just last month, they released another report that focused in on Pacific Islander infant mortality. So it's through these networks that the Utah Health Department, working with our organization, working with the Queen Center, working with other organizations here in Utah, that they were able to say, hey, listen, you know, they're here at the table, we were there expressing what our needs are and things of that type, that we kind of, because as you see, we're only 1% of Utah, but as a small population, if we're not at the table, then most of the time we're kind of kicked to the side and nobody really, not that they don't care, but there's a whole lot of things out there. So if we don't go out there and kind of take charge, or at least bring our issues to the table, oftentimes we get neglected and we're play that when we are that invisible role. So I think it's networking, getting out there and doing the things that we need to do by you know, presenting our issues will help us go further. Okay, next. So some of the things that we've kind of put into action real briefly is for example, benefit rolls up. We were able to obtain a grant where we were able to hire a person that specifically, and on a part-time basis, we didn't get that much money, but we did get enough to hire a person that that could concentrate on enrolling people. So we wanted to make sure that Pacific Islanders that were qualified for these benefits, that ACA, especially the screening deal and things like that, we were able to get that. We are working to enroll them. So every week people can come in here and we have that person here to help enroll them. And especially with language barrier and cultural barrier, oftentimes when government sends back a piece of paper and say, hey, listen, we need more of this, some of our people will just toss it because they don't know what's happened, so they think that they're not approved. And so some of those things we work through. Community wellness coaches, we have a grant that allowed us to hire a community wellness coach trained with and that was through the University of Utah, and they go through a 14-week training period, and then they will work with our community to assist them so that they can make so that they can move towards a self-reliant or better health care. Anyway, help them to take care of themselves. Also translation, we're able to get a grant to help translate the Medicaid, the National Medicaid booklet, so to assist our people so that they can understand what's going on. Also data collection, funds come in to help with the data collection so that when we go in to talk to the to legislative and all those kind of folks, we have data because that's the language they speak. If you come in with just all your emotion and things like that, sometimes that helps, but you have to speak their language, which is basically data collection. Also the networking and collaboration, again, so important. Legislature training, like we've had Litback, who is our minority whip, has come in and actually even trained our own people and also trained something that we had put together with the Health Forum. I mean, he tells us great things like, for example, when you go and talk to the legislatures, talk to them as if they were third graders. When you go in there, make sure you have certain things in place, you know, like a real bullet points and be quick. And anyway, a lot of fun things that we get to know in order to be effective when we go in and talk to these lawmakers. Opportunities for political, like for an example, last year we were able to take 16 of our senior citizens up to the Capitol, and these are Pacific Tongans specifically, to go up and speak on behalf of Affordable Care Act. So those kind of things, you know, came to us through the Utah Health Policy. They needed that, and so we were able to get that together. And then, of course, again, increase awareness and share with community. Okay, next. Okay, these are really quick lists. I know this is the last slide, and so I just wanted to, these are some slides, and you can read it on our own. These are people on our website, on our Facebook website. We have like 16, 17 people that shared, and it's in Tongan, some of them are in English, share how Affordable Care Act has helped them, you know, get their health care. So these are some of those experiences, and I know the time is right now is over, so I'm just going to turn that up, and you guys can read that on your own. And next. Thank you.
Fahina, thank you so much. That was really good, and I will encourage everybody to read those stories. They are amazing stories from our community, and I just thank you so much, Fahina, for sharing those with us and sharing just all of the great work that you guys are doing. So I am going to, there were two questions that came in, and I believe they were directed at Marguerite, so I'm going to just read them aloud, and then Marguerite can answer those. So this is from Mary Jung, and it says, going back to the importance of preventative care, are there any specific sources, academic papers, government reports, where she can find statistics on how cost-effective or money-saving preventative services can be?
Yes, there are several sources. One of the places you can start to look, first of all, is the Kaiser Family Foundation, and they actually track a lot of the resources that are going into different prevention areas, but they'll also have the backing in the papers that support, you know, and have evidence about why we need to do that prevention. Also, healthcare.gov has that information, and the Institute of Medicine, because so many of the guidelines that, well, almost all the guidelines we're using come from the Institute of Medicine.
Great. Thank you.
Uh-huh.
So, and then there's one more, and this is from Jamie Felicitas, and it says, where is the money coming from to fund all of these initiatives brought forth by the ACA?
All right, that's a really good question. The money was actually authorized and appropriated when the law was passed. Now, there are some, so that's the money that you're seeing coming out now came along with the law itself. There were some pieces, though, that were not appropriated, even though they were in the law, such as the Class Act. Class Act was a provision that was going to be able to set up a plan for long-term care. And they were not able to find money for that, so that has been put on the shelf for now. There are some other, some of the prevention fund money has actually been, they're looking at that to see if they should take it back, but initially the money was all appropriated and authorized when the law was passed.
Okay. It looks like we have one more. Actually, and I'm just going to, anybody can jump in and answer this, but this is from Kyle Barrett. Are there translation services available through Medicaid as brought up by Fahina? I guess so, Fahina, if you would like to try to answer that.
Thank you. Well, what we did is that we were funded by the Medicaid office over in Denver, one of the offices, the regional Denver. So we were funded to translate that. So I am guessing that they do have funds for translation. I think Marguerite would probably have more, but I believe that that's part of the Affordable Care Act, is that the people get culturally competent, care. Most especially being that that's a really important part of staying healthy for our folks, because there's studies that showed that if the people are not culturally competent, that people don't know, most of the ethnic people, especially in our community, Pacific Islanders, they don't return, they don't go, they don't feel like the providers are understanding them, and so their health gets worse.
Thank you. Well, so we are actually 1 minute over the hour, and I just wanted to say again, reiterate, thank you so much to Marguerite, Fahina, and Sefa for joining us on the webinar and just really educating us on the Affordable Care Act and helping our communities progress as we, go forward into the future with it. And really just appreciate everybody. And for everybody that is on, thank you so much for joining us. If you have any other comments, questions, or concerns, please just email info@apiahf.org, and we can answer your questions. And also, just to follow up, we will be sharing this webinar and the recording with everybody as soon as we get it approved from HHS and also the White House Initiative. So thank you so much, and have a great rest of the week.
Okay, thank you.
Thanks, folks.